asked a question on the live, and for the purpose of this question, I'm going to bring back my diagram. Now, the question is, can I use non-scented or non-alcoholic wipes on my vagina instead of tissue? Now, remember, we said all of this is not the vagina. But if you're going to use a wipe, yes, I would recommend that you use something non-scented and without alcohol to wipe the external, because you can clean the external part of your reproductive system, right? Because the labia needs to clean, and even the clitoris, wipe it down, you know? All of the places can be clean. Remember, the urethra is right here, and we urinate through our urethra, so we definitely need to clean all of this. What we don't need you to do is to insert anything. Come, show me your 3D model. The 3D model. So don't insert anything to the inside of the vagina.
Anything on the inside.
Okay, but outside can be cleaned. All right?
Yes.
Awesome. So, can we move on?
Yes, we can move on.
Discharge. Now we talk about the independence of the vagina and how she takes care of herself and all of that. And as a part of how she takes care of herself, she gives us different clues and inklings, and discharge is one of them. The color of your discharge can tell you something. The smell of the discharge can tell us something. So tell me a little bit about that. Tell me how the vagina functions and what the discharges can mean.
Okay. All right. So before I get into that, I see a question, just since we're going to leave that topic.
Yeah, man. Go ahead.
What wipes do I recommend? Baby wipes really are great because they're sensitive. Your vagina is like a baby. So baby products are actually great things to use to wipe around the vagina, especially when the time of your menstruation and you want to feel a little bit more fresh. Baby wipes. What brand? Just get a pair of baby wipes.
Unscented.
Unscented baby wipes. And in terms of the soap, same thing. Unscented soaps with no alcohol, nothing that will throw, no strong scents or products that will throw off the pH of the vagina. Now, in terms of discharge, I always get the question with my patients, is discharge normal? Like, I have this discharge and something must be wrong. Yes. Discharge is very much so normal. In fact, that is a sign that your vagina is working properly.
Correct.
The vagina cleans itself. It flushes itself out, right? Whatever's in there that don't belong in there have to come out some way, right? And how is it coming out? Through discharge. Now, there's normal discharge and not so normal discharge. Now, the normal discharge is usually an off-whitish, thinnish discharge with minimal scent in keeping with how you normally smell, right? And that's just in a nutshell what it is. As I said before, y'all, I have a whole YouTube video on this, so you can just check that out. But to quickly touch on it, abnormal discharges, there's a list of abnormal discharges, but what I'll do is talk about the most common ones that are abnormal. Right, the first one we can talk about is the yeast infection. Well, you know what, I'll talk about the most common. The most common is actually not yeast infection, it's a bacterial vaginosis. And bacterial vaginosis is a condition that, the fishy odor we were talking about earlier? Yes. Usually that's the cause of the fishy odor, right? So that is not something that is normal. And what happens is that bacteria, the good bacteria that we were just talking about, those levels go down because of different things that can affect it. And then bad bacteria now overgrows and just takes over the vagina. Now this discharge is itchy. It is thin like normal. However, instead of being off-white, it usually has a grayish or yellowish color. So any color that is not white or red, which is your menstruation, or brown when the menstruation is ending, colors like yellow, green, dark gray, clump, those things are not normal, right? So in the case of bacterial vaginosis, which we just quickly spoke about, those are the things you'll see. And the reason is because the normal bacteria is just thrown off and the pH level is thrown off. Now, yeast infection, this discharge is itchy. Now, I don't know if anybody has ever heard of the itch you cannot scratch. That is so tormenting, and it's so unfortunate because a lot of women don't know that this is something that 70% of women experience. It is something that's so common and nothing to be ashamed of, and that is because yeast loves dark,
warm spaces.
warm spaces.
Mm-hmm.
And let me tell you something about the vagina. That is the environment.
That's
and
what
that's
it
how
is.
it's created. That's what it's supposed to be. So
Mm-hmm.
what happens with that discharge, it can be very thick, very itchy. And if you see that, you know that, okay, something's not right. Because
Yes.
discharge is not normally itchy and not normally very thick and clumpy, right? So those are some examples of abnormal discharges. And as I said, if it's itchy, if it has a foul smell or abnormal smell or strong smell, and also if it has a color that's not off-white in that range other than
Right.
blood, then you know something is not right.